Thank you so very much, and thank you for the kind invitation to present to you today and discuss the update in terms of Canada's guidance on alcohol and health. The objectives are fairly straightforward. Um, Hopefully you'll understand the prevalence and health impacts of alcohol use in Canada. At the conclusion of this, be able to describe the continuum of risk that's associated with the number of drinks consumed, and also, as a result of that, harm reduction approaches to mitigate or minimize risk. Thirdly, to describe how risks and harms of alcohol use are influenced by both sex-based physiological differences as well as gender-related factors and the complexity related to those. And finally, to understand risks and recommendations related to alcohol use among specific populations, including youth and people who are pregnant, trying to get pregnant, or breastfeeding. Next slide. So it's really important in opening up the conversation with regards to people's use of alcohol as to why do they drink. And this is a non-threatening way. It helps to situate people in a personal and social context much better. And it's broken down to be either personal effects or social effects. With regards to personal effects, people drink alcohol for enjoyment. Sometimes it's quite deliberate to get drunk, and that's more of an adolescent pattern, but also it persists into adulthood as well. Frequently, people use substances of any sort to change the way they feel, to alter mood, perhaps to avoid boredom or to escape. So if some of these reasons are driving it on a personal level, you can begin to think about alternatives. I have a problem with my video feed here. I'll be flicking it off and on periodically. But there are also social factors that lead to people, and these are to celebrate special occasions. Alcohol is frequently used to mark transitions with regards to birth, death, marriage, or some other celebratory occasion, a promotion. It often marks the end of a work day or a work week and the beginning of free time. So we use it in many different celebratory contexts. People use it as part of a social ritual, but also to socialize as well, to disinhibit. And also, interestingly enough, to increase power. When you think of power lunches and that sort of thing, or the trading of shots back and forth to assert some sort of dominance because of some perceived higher level of masculinity with regards to the ability to handle one's liquor. This also happens, in feminist patterns as well. So these are not mutually exclusive. Frequently, social and personal effects are combined, but it just helps to tease out what the nature of people's relationship is with alcohol, because what we want to do is shift that relationship, particularly if it's problematic. Next slide. So in terms of alcohol use in general, well, in terms of alcohol use disorder, first of all, 1 in 5 Canadians meet criteria for an alcohol use disorder in their lifetime. So that's a significant burden. 5 million plus Canadians aged 12 and over report heavy drinking at least once a month. So these are the individuals. The heavy binge drinking is usually a precursor to the development of an alcohol use disorder. To clarify that, though, not everyone who binge drinks has an alcohol use disorder, but everyone who has an alcohol use disorder engages in binge drinking. Next slide. When we begin to break this down in terms of the population, generally for those that are 15 and over, 78% of the population have tried alcohol or used alcohol in the past year, but 22% of the population has not. So there's a pretty consistent 20 to 23, typically 22% is what's referenced, that are abstinent. When we look at adults that are older, if we start to drop off those that are between 15 and 25, then we see, of course, closer to 80% of people who have drank in the past year, but again, 21% who have not. Next slide. If we start looking at it in a more granular fashion, particularly with regards to youth in age 15 to 19, so this is prior to the onset of legally drinking age, usually 18 or 19 across Canada, but also early youth, early adulthood. So we see the shift here. And what's interesting is that although 57% of people aged 15 to 19 have consumed in the past year, 43% have not. So this is important when it comes to developing programs that are youth focused to denormalize heavy binge drinking. Everyone does not engage in drinking. Everyone does not engage in heavy binge drinking, contrary to what people tend to believe. So it's important to denormalize this and also look at asset-based approaches as to what has meaning and purpose in people's lives that lead them to make decisions that are about less alcohol consumption. When we get into young adulthood, higher levels, it's now legal across the board, higher levels of people are obviously trying alcohol. Not all of these individuals will continue, but it's a process of experimentation. And unfortunately, the way a lot of people are socialized to drink in Canada is by drinking to the point of running into negative consequences and then backing off, which is problematic. And that's where the Canadian Guidance on Alcohol and Health hopefully will be helpful in presenting to Canadians an approach that hopefully will keep them from experiencing harms, which could include very traumatic events, sexual assault, violence, trauma. But again, do it in a way that's more socially proactive. Next slide. The health impacts of alcohol use go far beyond the development of an alcohol use disorder. And it's really important that we begin to think about this as a whole health approach. When we consume a substance, when we consume alcohol, we don't direct it to what part of the body we want it to go to. We don't say, I'm doing this for my coronary arteries, but I'm going to forget about the atrial fibrillation that I'm at risk of, or the hypertension. I'm going to ignore my liver, what it's doing to my brain, and so on. So I think we need a whole health approach in order to raise the level of alcohol literacy so that we have a better appreciation of the health risks and the potentially negative impacts that alcohol may have, including 7 different types of cancers, cardiovascular disease. We'll unpack some of these in subsequent slides, liver disease, lower respiratory tract infections, but also other infectious diseases as well. And then injuries and accidents. So it's not only injuries due to violent or motor vehicle collisions, but also injuries due to accidents, which could occur walking down the stairs when one has consumed too much, turning an ankle on the dance floor, whatever the case may be. Next slide. So when we think about alcohol attributable deaths, 10,500 occurred in Canada in 2016, which was over 4% of all deaths in Canada. And this represented 6.3% of all potential years of life lost. So this is where we begin to unpack the further health and community health impacts with regards to beverage alcohol. It's not only the individual, it also has impact on the family, it has impact on the community and society more broadly. And the Canadian Substance Use Cost and Harm Survey results done by CISA in conjunction with CCSA, is very helpful in unpacking this jurisdiction by jurisdiction, as well as nationally. Next slide. But also, what is absolutely fundamental when it comes to alcohol literacy is this concept of a standard drink, because it's really, really hard to manage what we can't measure. So if a standard drink is not well defined, then how do we really help and coach people to reduce it? So it really comes down to 13.45 grams of ethanol, and that is represented by 12 ounces of 5% beer or cider, 5 ounces of 12% alcohol content wine, although this can vary, and that's one of the challenges, and I'll come to that momentarily. as well as 1.5 ounces of 40% alcohol in the form of spirits. The challenge here is that you might have a fortified beer that's at 8%, you might have wine that's at 14%. So this is where standard drink labeling is really, really helpful. So you can interpret or translate at the point of pour how many standard drinks are in this container. And then it's a whole lot easier to do the math as opposed to alcohol by volume, which is what's currently measured and labeled. Next slide. So when we were doing the modeling for this, we looked at the relative risk for the development of different conditions leading to premature morbidity and mortality, which was actually 17.5 years of life lost. So we did those curves compared to lifetime abstainers. Now, lifetime abstainers is a different population for comparison than current abstainers, because current abstainers include sick quitters, people who can no longer drink because they're ill. Doesn't mean that they have an alcohol use disorder, but they may be on medication, they may have cancer, they may not be able to drink anymore because of their health. So in order to have a clearer view of this relationship between levels of alcohol consumption and the impact on health, we used lifetime abstainers for comparison. And then we drew those relative risk curves, and then we wanted to look at absolute risk. The 1 in 1,000 risk level is the international standard epidemiologically for voluntary risk. And this is actually comparable to the risk that one has of drowning nationally. Now, it's going to be different in the prairies compared to the coast, but obviously across the nation, roughly 1 in 1,000 is the level of risk of dying from drowning. That came out at 2 standard drinks per week. 1 in 100 is 10 times greater, and that's the level of risk that has been used historically and applied to alcohol, not for health reasons, but for social, for economic, and cultural reasons, because of how much societies, including our own, has been invested in beverage alcohol. It doesn't improve health, contrary to people's notion. While it makes everyone happier, so therefore it must have a more positive benefit, doesn't relate in terms of morbidity and mortality. So the 1 in 100 is actually comparable to the level of the risk of dying from a motor vehicle crash. And you can certainly argue that some people may have to drive, but that's still a pretty high level for entirely voluntary activity. We often have to drive for work and other purposes, and we'll take on additional risks because we're compelled to do certain things. But for something that's purely voluntary, that 1 in 1,000 risk level is considered more appropriate. Next slide, please. So this is how it distilled out. When we looked at the many different causes, there's over 200 conditions that are related by ICD coding to alcohol use that are causally associated with alcohol use. Then we look at the best evidence, do the relative risk curves, and then do our absolute risk levels. So that 1 in 1,000 risk level comes out at 2 standard drinks per week. Below that is what we considered low risk. Between 1 in 1,000 and 1 in 100, it spans 3 to 6 standard drinks per week. So a moderate level of drinking within our guidance would be no more than 6 standard drinks per week or lower. And that's comparable now to that 1 in 100 level of risk, and actually the more closer to the international standard for low risk. But it doesn't transparently present to Canadians what the risks are. So even in that moderate risk range of 3 to 6 standard drinks per week, you're increasing your risk of developing different types of cancer, including breast and colon. Once you get to 7+ standard drinks per week, the graph goes up exponentially, it's more steeper, and you're getting into an increasingly high risk zone. So our recommendation to Canadians was simply advising them to reduce the amount that they drink. If you're going from 16 to 12 standard drinks per week, you're going to improve your health. Even if you're not getting down to the moderate risk level, every standard drink per week reduction is a gain. Next slide. We also looked at sex and gender-based differences, and we know at higher levels of alcohol consumption, women are more vulnerable to the impact of beverage alcohol because they have decreased lean body mass, decreased alcohol dehydrogenase, which metabolizes alcohol, it breaks it down. And therefore, drink for drink, they will have a higher level of blood alcohol concentration longer than a man will. And this is based on cisgendered studies. So at the lower levels, when we're talking about moderate and lower levels of drinking, there isn't a significant difference based upon the physiological differences. However, once you get into the higher risk zones, it increases in terms of the impact on males and females in particular. However, what we see in terms of patterns of consumption is that amongst men, there's a higher level of alcohol use, higher level of binge drinking, and a higher prevalence of an alcohol use disorder. And of course, heavier use relates to higher rates of hospitalization, higher rates of death, primarily from cancer, heart disease more broadly, and cirrhosis. There's also higher levels of perpetration of violence. This is violence across the board. This is generalized violence. This is intimate partner violence, and this is sexual violence. This has an interface, though, with both the sex aspect in terms of the combination of alcohol with testosterone, as well as with gender behavior with regards to toxic masculinity and the assertion of masculinity in violent ways. So that is a whole area of knowledge mobilization that needs to be unpacked. However, when we look at women, there's increasing levels of alcohol consumption. The so-called pinking of the industry, marketing to women is very, very strong, particularly through social media. This is very similar to the Virginia Slims tobacco campaign that targeted women and led to increased deaths from cardiovascular disease and lung cancer. There's an increased likelihood of liver cirrhosis and breast cancer in women, increased risk of death relating to heart disease. But as I mentioned before, this is certainly much greater when you get into 6+ standard drinks per week. Next slide. With regards to other populations, for people who are pregnant or trying to get pregnant, the safest choice is not to drink alcohol at all. Similarly, for people who are lactating and they're feeding a child through lactation, again, the best recommendation is not to drink alcohol at all. With regards to youth, although a lot of the relative risk curves were done amongst people who were age 15 and over, generally speaking, the first recommendation when it comes to youth is to delay onset of substance and alcohol use specifically as long as possible. Delay, 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 and you end up with better results. Less chances of developing an alcohol use disorder on one hand, but also avoiding trauma that's typically experienced in these age groups related to acute intoxication. So the other recommendation, there are 3 recommendations from the guidance. One is recommending to Canadians to reduce the amount of alcohol or consider reducing the amount of alcohol. Secondly, with regards to people that are pregnant or trying to get pregnant or lactating, not to use alcohol. And thirdly, with regards to per occasion drinking, the recommendation is not to have more than 2 standard drinks on an occasion. Once you get above 2 standard drinks, there's a greater likelihood for violence, accidents, and injuries. And this is germane in terms of a harm reduction message to youth. Nevertheless, the first message primarily is to delay onset of use as long as possible. Next slide. There are certainly situations where people should avoid alcohol. And clearly, if they're driving a vehicle or using machinery or tools where they're putting themselves or other people at risk, it should be avoided. Taking medication or other substances that would interact with alcohol, doing any sort of dangerous physical activity. And this would include sporting activity. People may not see it as dangerous, but if they were acutely intoxicated, it could quickly become so. They may not have insight into the speed, and their coordination may be lost. Clearly, again, pregnancy or whilst trying to get pregnant, responsible for the safety of others, caring for infants, caring for children, caring for elders, and so on. And then, of course, whilst making important decisions. So this is not an attack on the chapel industry in Las Vegas, but frankly, not a good place to get married if it's a snap decision. Next decision. Patient education, less is better. This is the seminal message. Less is better. So this is to help people to actualize this. We know that drinking less has positive benefits for people. And reducing it can improve health. So it's helpful for people to actually pick a target, to be concrete, and then understand what a standard drink is and drink within those limits, so that they're having non-drinking days during the week, that they're not exceeding their 2 drinks on any day, that they're keeping within, hopefully, their goal or target. And this way, they're becoming more aware, they're monitoring, they're measuring, they're working towards their personal drinking goals on one hand, but also their health goals on the other. And to reinforce this, it's really important to talk about how any reduction in alcohol use is beneficial. Next slide. So what are the benefits of alcohol reduction? Well, people have more energy, they sleep better, improvement in cognition and memory, improvement in mood, improved sex life. Although, yes, alcohol disinhibits, overall, the sex life, the choice of sex partner, and that sort of thing tends to lead to a better sex life. Improved immune function because of the negative effect of alcohol on the immune system, improvement in the qualities of one's relationships because one can attend, one can be present, one can respond in the moment more effectively, and of course, a benefit in terms of financial savings. There's reduction in weight, there's significant calories attached to alcohol, decreased blood pressure, blood sugar, triglycerides, liver fat, cancer risk, and risk of accidents and injuries. So a host of benefits. And these are the things that I think in a very positive way we should be presenting to the Canadian public. It's not about finger wagging, it's about helping people to make constructive change to improve their health and well-being. Next slide. So there are different harm reduction approaches with regards to this. Eating before and while drinking helps to slow the absorption of beverage alcohol and improve or help people to decrease the amount that they're actually drinking. Deciding on a weekly target and sticking to that limit is helpful. If people can't stick to their limit, then there's a question that rises in one's mind. Is there a challenge here in terms of control over their drinking? Are they losing control? Which, of course, is one of the criteria for an alcohol use disorder. Encouraging people to explore low alcohol or alcohol-free products. There are more and more on the market. And what's interesting with alcohol-free products is that there's no kickback from the industry with regards to nutritional labeling in order to get product placement in grocery stores. Absolutely no whinging or complaining there. Keeping track of the number of standard drinks is important. Again, learning how to measure that. Choosing drinks, as I mentioned, with a lower alcohol content is great. Industry is responding to this, craft brewers, mocktails in restaurants and so on. Having water on hand, if you alternate an alcohol beverage with a non-alcohol beverage, which is another bubble up here, you're going to have less of a hangover effect with that as well. Drinking slowly in small sips is much, much better than shooters to, again, slowly absorption. Next slide, please. So in summary, Alcohol use in Canada is both high and problematic. It has negative health risks. These include cardiovascular disease, specifically hypertension, atrial fib, and flutter. Also, with regards to hemorrhagic stroke at higher levels. At higher levels, you then get into issues with regards to ischemic stroke and ischemic coronary artery disease. But the World Heart Federation came out with a policy statement in 2021 that said alcohol is not good for heart health. Across the board, don't drink if you're thinking you're doing this to improve heart health. It's counterproductive. There are significant sex and gender-based differences. This is going to require much more nuanced knowledge mobilization, and I know CCSA is looking for partners with this. Specific populations have unique considerations and risk associations, which again means that we need to be thinking about different knowledge mobilization tools and approaches. Alcohol-related harms on a risk continuum. There's no absolutely safe level. Risk increases with the amount consumed, but certainly what we know is that 1 to 2 standard drinks per week would be considered low risk, and 3 to 6 would be considered moderate. 3 to 5 would be considered moderate. 6 plus would be getting into that increasingly high risk zone. So we recommend that people consider reducing their alcohol consumption. And there are some very concrete, simple harm reduction strategies that can be used to help operationalize this. So with that, I'll thank you for your attention. Happy to take any questions that you may have. And I'll turn it over to our moderator.